Why are Lynch syndrome and FAP breakthroughs important for family colorectal health? Imagine a family where colorectal cancer seems to run in the blood. Thanks to recent advances, doctors can now identify specific genetic conditions like Lynch syndrome and familial adenomatous polyposis, or FAP, that cause this pattern. These breakthroughs are game-changers because they help families understand their unique risks early on. Lynch syndrome is the most common inherited form of colorectal cancer risk. It happens because of mutations in genes responsible for fixing DNA errors, like MLH1 or MSH2. When these genes don't work properly, DNA mistakes build up, leading to a high chance of developing colorectal cancer, often in the early 40s. But knowing this allows doctors to recommend more frequent colonoscopies starting at a younger age, catching problems before they turn into cancer. It also means screening for other associated cancers, like endometrial or stomach cancer, can be part of a family's health plan. FAP is caused by mutations in the APC gene, which leads to hundreds or even thousands of polyps forming in the colon and rectum, sometimes as early as adolescence. If left untreated, nearly everyone with classic FAP will develop colorectal cancer by their 40s. Thanks to genetic testing, families can identify who carries the mutation and take steps to prevent cancer. This might include regular colonoscopies or even preventive surgery to remove the colon before cancer develops. Because FAP is inherited in a pattern where each first-degree relative has a 50% chance of inheriting the mutation, knowing about it helps families plan ahead and make informed choices. The importance of these breakthroughs is clear. They help distinguish between inherited syndromes and sporadic cases, which is vital because each has different risks and management strategies. They enable personalized risk assessments, guiding when to start screening and what kind of tests to use. Early detection through these methods can save lives by catching polyps or early cancers when treatment is most effective. Plus, understanding these syndromes raises awareness of other cancer risks outside the colon, leading to more comprehensive care. It also helps families with reproductive planning, since these conditions are passed down. In essence, these scientific advances give families the power to take control of their health. They form the foundation for targeted prevention and early detection, reducing the burden of colorectal cancer and improving outcomes. Always remember, if you have a family history of colorectal cancer or related conditions, consulting a healthcare professional for personalized advice is essential. These breakthroughs are about giving families hope and tools to protect future generations through knowledge and proactive care.